Welcome to IMCAS TV, 10 Minutes with Plastic Surgeon Michel Ruif. Welcome.
Welcome.
Our topic, patient safety, is one that you feel so strongly about. And in the next 10 minutes, we're going to hear about how to optimize patient safety before and after surgery. And you and I spoke earlier about the lack of awareness in France and the rest of the world, less so perhaps in the United States, about the common problems associated with surgery. Pain, of course, is the obvious, but there are others.
Yes, of course, the quality of the procedure in surgery is very important, but in fact, there's a lot of things around the surgery, and of course, pain. But what is most important than pain would be nausea, vomitings.
Vomiting.
It's very, very uncomfortable, and of course, hypothermia. That is low temperature. It's very important for instance, the infection. So a lot of things, smoking, stop smoking. It's very important. A lot of things to improve, to get a good idea and a good comfort around the surgery.
And a good outcome.
And of course, a good outcome and a good result.
Thrombosis is
Sure.
another
Very,
important issue.
Maybe it's the most famous for the surgeons, but really other things around that, hypertension.
Hypertension.
Hypertension, yes. For instance, because it's hematoma after hypertension, it's pain. So all these things are together.
Yeah, and how do we prevent this? These symptoms.
What is very interesting is to share with the surgeons and to learn together how to prevent all these things. And this prevention is not just before the surgery. It's a few weeks before and sometimes a few months, you know.
Yeah.
Smoking, you have to stop really 2 months before, really.
But often the patient doesn't see the surgeon 2 months before the surgery.
Oh, usually they do that because we have to take time to take the decision. So we have the time to do that.
And are these problems specific just in plastic surgery, or will a patient have these problems in all surgeries?
No, this problem is in fact is interesting for all the surgery, but it's maybe it's more important for aesthetic surgery because we speak about comfort, and we have to get a very good result, a very good comfort, a very good service.
Yeah, and are safety procedures different in different countries? Is there standards, regulations, a checklist, if you will, in an operating room?
This is a culture because, you know, United States made this culture of surgery. The American society made that as a really a policy, a very main policy. So I like the idea with France, and we are promoting all these things around.
Tell us about, you're wearing a button, patient safety. I see. So you are really promoting patient safety, trying to get your message out to other doctors. And how are you doing that?
Of course, we do courses, teaching courses, but the most important for the moment is to learn to the surgeon that this is their own.
To teach the surgeon.
I'm sorry, to teach the surgeon that it is their own problem. This is not only anesthesiologist, you know. This is for the surgeon as well.
Exactly, exactly, and we can learn better safety from other countries, can't we?
Yes, we can, and certainly United States.
The United States.
Maybe because they lack this idea of service.
Well, they're also afraid to be sued all the time.
Yeah. Yes, sure. Yes, sure.
And the problem also seems to be a lack of dissemination of information. A problem happens, the solutions to the complications need to be shared, and these solutions to complications need to be shared very quickly. There is a time is of the essence. Is the medical community doing anything about getting the information out and out fast?
You mean to get the information after?
Exactly.
And to take new position to prevent this problem. Yes, it takes time. And of course, you have website. You can find all these things. We have to edit brochure to give that to the population. I think they are really interested in, and the fact to be interested in is very important for us and for the patient.
And in terms of comfort and attention for the patient, have we made improvements?
Tension, you mean mind tension
comfort,
or
your
hypertension?
A doctor's attention.
Ah, yes, sure.
Attention.
Sure. The comfort, you know, it's very important in the operative room as well. And the tension between the patient and the surgeon is in the safety, because the fact that you are comfortable with me or with your surgeon is very important. Very important. The anesthesiologist has used to say that when you go to the surgery, you have to be very comfortable, and you are awake comfortably if you just have slept comfortably.
Right. Often the patient doesn't even see the doctor during the procedure.
Of course, but before.
Before, yes.
And after.
And after,
Yeah,
and
sure.
after. So it is a question of before and after.
Absolutely.
And
of course, you spoke about checklist.
Yeah.
Now there is some rules, and the checklist is a good thing in the operative room, but it's not sufficient. One of the ideas is to have the surgeons would get their own checklist. That means a real checklist, like an airplane.
Like an airplane,
You
like
know,
a pilot before he takes off.
Everything before in the surgery and the things after for several weeks. So this is not only during the procedure. This is really an attitude.
Yes.
An attitude, and with a real checklist.
That needs to become a habit.
Yes, a habit, a real habit.
A habit.
Yeah.
And you said that it's tough to get doctors to listen, not to listen, but to spend the time to really talk about patient safety. Yeah. Has this been changing, or
yes,
in the recent years?
Usually the notice maybe this patient safety is not so sexy, you know.
Well, I can tell you I'm on the other side of the fence, and
sure,
I think it's an important issue.
When you put in a program, a scientific program, patient safety, you know, it's not very, I'm sorry, it's not very sexy. And the people don't go to this kind of program. But really, when they go to this, when they hear what we can discuss, they find really very interesting things. So the problem really international.
Yeah.
This is to convince the surgeons to hear about that.
One message that you can tell surgeons, because you have them all in one place
at
one
time.
So
come to the patient safety.
When is it and where is it?
Where is it? It's in IMCAS, of course.
Yes.
But it's now. I hope it will be in the French Society, French Aesthetic Surgeon Society, because I will be president next year. I would like to have some workshops about that.
Yeah, and it's not just important for surgeons to come. It's just as important for dermatologists, for
yes,
the cosmetic dermatologists.
In IMCAS, we discuss with dermatologists and plastic surgeon. But of course, it's right for ENT, for gynecologists, and so on.
It pertains to all.
Absolutely.
Well, thank you so much, Dr.
Thank you so much.
This is really
important,
and I'm glad we can talk about it. Thank you.
Bye-bye.